So we have an exercise for you to do around PDSA. So just to recap, you find out what you're trying to accomplish, you work out how you're going to know what a change is, and then you do several PDSA cycles to see what improvement you can get out of the system. So on your table, you will find 20 pieces of spaghetti, 1 marshmallow, some string, and at the back of the room, on the left-hand side, there is some tape, which we'll ask you to go and collect in a minute. 1 piece of tape per table. And what you're being asked to do, using just those things, is to create the highest structure you can that has a full marshmallow sitting on the top of it. Okay? You cannot use anything else, all right? And I've done this many times before, so I've seen many people try. Okay, if you've bought some spaghetti or linguine to eat this evening, you cannot add that to the amount of spaghetti that's on the table, okay? A tall person standing on a chair is not a structure made of spaghetti, okay? Holding a piece of spaghetti with a marshmallow on top, okay? You have 18 minutes to complete the challenge, and at the end we will go around, we'll measure the structures and see who has been most successful. Typically what happens when people do this is they spend a lot of time planning and then building, and then at the end they go ta-da, and it either stands or it doesn't stand. And as you can see in the ROM, a number of them fell over right at the last minute. And that's almost certain failure. Okay, so if you do this with groups of people, who does this particularly badly, do you think? The worst performers are recent business school graduates. And why is that? Because they've been taught at business school that you have a plan. They spend a lot of time jockeying for power, seeing who's going to sort of be in charge of the group. And the plan doesn't deliver because they don't do the actual work right at the beginning. Who's good at this, do you think? Who's particularly good at this?
Kids.
Yep. Kindergarten children. Yeah, 5-year-olds. Okay. And why is that? Because what they do is they plan, test, plan, test, plan, test. They try out all sorts of different structures, okay, and see what's working and what's not working. Of course, they've got imagination, and they come up with some of the most amazing structures. So that's the average height. Sorry, it's in inches. So the winners here did much better than the average height. Business school graduates, half the normal size. Lawyers, not that much better. Pleasingly and reassuringly, architects and engineers are the best at this. Okay, so the best structures are made out of using reinforced triangles, basically. CEOs are no better than anybody else, unless they've got their executive assistant working with them. Okay, in which case they do much, much better. So, if you do this in a sort of group of people, with a group of people like this is what you end up with, about 4 non-standing structures. So what do you think happens if you offer people $10,000 for the highest structure? So we came in here and we said to you, we'll give you $10,000 to the person who actually does the best. No one produces a structure that's standing, okay? So an incentive by itself makes no difference whatsoever. If you train people in the methodology and they've had some time to practice, it makes a big difference to performance. Okay, so having the skills is really important. This is what today is about learning some of the basic skills around quality improvement. Okay. and training people, expecting people just to do things just because you tell them to do it is not likely to work. So, PDSA cycles. Plan, first point. Make a prediction about what you think is going to happen. Okay? You carry out your test. Record in your observations, begin your analysis, and then when you've completed it, look at how you've done compared with how you predicted you were going to do. Okay? And then what changes are you going to make the next time round? I have worked in an organisation where we had at one point about 150 quality improvement projects running. It's okay to fail. Yeah, indeed, failure is inevitable. But if you're going to fail, will you do it quickly? Yeah, don't spend 9 months failing with sort of one PDSA cycle a month. Okay, small-scale change happening rapidly. Plan, do, study, act. Use this as a type of template for each PDSA cycle. Very small scale. Okay. It's fine to do a simulation test with 1 patient for 1 hour in 1 ward or 10 patients. People tend to think too large, okay? And I was teaching on a course that's run by Waitemata earlier on this week, not just for mental health, it's across the whole organisation. And people were trying to do stuff on like 5 wards on 2 different sites. That's way too big. It won't work. You need a different methodology for moving from sort of what you've got working in one unit to what you've got working across the whole of the organisation. Think a couple of cycles ahead. Scale down. Do it as rapidly as you can. I think there's a thing up there about East London's violence and aggression reduction programme. They were doing sometimes 2 or 3 PDSA cycles a day on the ward, especially at the beginning, trying to get it sort of working shift by shift. But really hard to decrease violence and aggression in the ward. Really difficult, as you know, to maintain some consistency across shifts. So really important that you get the sort of early work going in a way which is sustainable. You're not looking for buy-in or consensus, okay? These are small-scale changes. You're not sort of dramatically changing the organisation. And you do need support. And this is Edison, who took 1,000 attempts to make a light bulb. Okay, I didn't fail 1,000 times. I found 1,000 ways of not making a light bulb. Okay, all right. Thank you very much, everybody.